You know, when you take a tiny small bite of something delicious and it just tastes like not enough? Well, that's how we felt after we had cannabis expert Dr. Patel here. So here she is again to answer some more of your cannabis questions. Welcome back, Dr. Patel.
Thank you. That was a lovely introduction. Very sweet.
Just not enough. The time went by way too quickly, and our audience wants to hear more about you and has more questions. And I just thought this is Autism and Parkinson's Awareness Month, and what a better time to have you back on and talk about neurodegenerative diseases and what cannabinoid therapy can do to help those.
Sure, absolutely. So should we go ahead and just dive right in?
Let's do it.
Okay, perfect.
Let's go on the deep end.
Okay, so let's start with autism. Autism is one of those conditions where parents come in struggling, because they've tried conventional treatment options, and some of them have even tried alternative treatment options as well. They first and foremost, a lot of these children are young, and they don't, these parents don't want their children on these heavy duty medications. A lot of them are, for instance, antipsychotic medications and whatnot. These children are having side effects, commonly it's like, for instance, drowsiness, which affects their ability to interact, to take in sensory information in their environment and whatnot, all of which ultimately leads to development. So what I want to start with is research first and foremost, okay? And I want to talk about one study in particular that looked at 60 children. These 60 children had autism. They were somewhere on the autism spectrum, and they were treated with high CBD and low THC medication for at least 7 months, okay? And the kids ranged in age from 8 to 15 years, and the average age was about 11 years. Now, 77% of the kids were considered low functioning, and 83% of the kids were boys. And the important thing to know here in this particular study is that for most of these kids, their conditions had not improved with conventional drug therapy. Okay, and this is similar to what I mentioned before in terms of the cases that I've seen in my practice. So about 72% of them, as I previously mentioned, a lot of these patients are on antipsychotics. So in this particular study, 72% of the patients were on antipsychotics, 17% were on mood stabilizers, 12% were on benzodiazepines, 7% were on SSRIs, 7% were on stimulants, 3% on clonidine, and 3% on propranolol. And I'm getting into the specifics because those parents who are watching these drug classes will be very familiar to them. And in addition to that, they'll be very familiar with some of the side effects that their children experience from these drug classes, okay? So in this particular study, the children's parents filled out questionnaires to assess the change in their condition over the course of the 7 months that they took this high CBD, low THC medication. And they were asked if they noticed any change in the child's behavior, the extent of the child's anxiety, because anxiety is a huge underlying component of autism, and whether their child's communication abilities had changed. Okay, so another factor that is hugely impacted when a child has autism. So overall, here's what was reported. So with the treatment over the 7 months with the high CBD, low THC medication, behavioral outbreaks were much or very much improved in 61% of the kids. The anxiety problems were much or very much improved in 39% of the kids. The communication problems were much or very much improved in 47% of the kids. Disruptive behaviors were improved by 29%. And parents overall, this is very important, reported feeling less stress. And this is a huge component as a caretaker of a child who has autism. There's, from a day-to-day basis, there are components that parents, struggle with and that contribute to their stress levels. Now, when it came to medications, over the course of the 7 months, over time, what happened was that 33% received fewer medications or lower dosages. 24% stopped taking medications altogether, and 8% received more medications or higher dosages. Okay. And this is important because one of the goals that parents come in to me with is that ultimately they'd like to either, completely and totally get their child off of conventional prescription medications, or if that's not possible, then to significantly reduce either the dose or the number of medications that they're on, okay? So as to improve their overall quality of life. So as we can see in this particular study, there was a high success rate, both in terms of results as well as the impact on medications. And I have seen something pretty much similar in the patients that I've treated. Now, what happens is that the improvements fall into 3 different categories, right? One is behavior, and the most common example of which is that aggression tends to be common, especially in boys with autism. So parents observe, with the use of a high CBD product, less aggressive behavior, fewer outbreaks, as was mentioned in the study. The other thing is communication. Okay, so parents have noticed that while communication abilities are still limited, we're not going to see miracles, but there's less frustration when they can't get across their wants and needs. Okay, so they will make multiple attempts without getting frustrated. And then the other thing is interactions. Okay, so oftentimes kids with autism tend to be, they tend to keep to themselves rather than interact with those around them. And what a lot of these parents notice is that with the use of a high CBD product, they're more interactive, right? And so this can include things like showing more eye contact, right? Showing more animated facial expressions. And then also they can have improved focus, improved attention, they listen better, improved language. They're more present as opposed to being lost in their own world. They're more engaged with others, like I previously mentioned. They initiate contact with siblings and other children. They're able to sit for an extended period of time without losing interest, reduce self-harm, as well as reduced harm to others. Reduce aggression, like I mentioned, fewer outbursts or tantrums, reduced obsessive compulsive behaviors, which is common amongst those with autism, reduced anxiety, and then they overall tend to sleep better and they're more receptive to help. So these are all, I got really specific so that the results can be relatable as opposed to just making it broad in terms of what exactly patients have reported, not patients directly, but either parents or caretakers or educators have reported back in terms of the changes that they've seen with the implementation of a high CBD product. Okay, so I hope that helps the audience in terms of what could be expected. Now, what's important to know is that it'll be a range, right? In terms of results, it's always going to be a spectrum, and it always depends on where your child is starting and where they'll land in terms of results, right? Because you have low functioning autism, and then you have high functioning autism, and so the baseline is different throughout the spectrum, right? So, what questions came up for you or for the audience while I was, going through that information?
Well, one thing that came up for me is that since we've seen the cannabis movement really take on in the last almost decade now. We have a range of clients or patients that come to us. Before it used to be that it was last ditch effort that they're turning to cannabinoid therapy. Now we're seeing people come first thing before even getting on conventional medication. In your opinion and in your practice, do you see a difference in results with people that have already been on medication or have never tried any medications? And what would you say to them?
Yeah, so typical cases that come in, they're in one of two boats, right? They're either on medication because to some level it's helping. It's just a matter of managing the side effects, and it may be a matter of introducing CBD products so that you can lower the dosages of the conventional medications. Okay, and then other parents have attempted a slew of medications and then have sort of just kind of put it on hold and are attempting to now use alternative treatment options, including the CBD products. In terms of using CBD as a first line treatment, it's certainly possible. I would just say, because we're sort of dealing with autism here, we're dealing with children. I think it's best to do it under the supervision of a physician, right? Because you want to very carefully monitor the condition. The other thing is that with children, and just in general, CBD is known in specific cases to elevate liver enzyme levels, right? So in children, that is something that should be monitored on a regular basis.
That's a great point. Do you suggest spacing in medicine with CBD?
So it's going to depend on the medication, right? So there are some medications that can be impacted by the use of CBD. One of two things can happen. Either, so basically what it comes down to is machinery in your liver. And you only have, let's just say, so many machines, right? And so if those machines are breaking down CBD, they can't break down the other medication that you're taking. So that builds up in the bloodstream, and when it builds up, it can potentially lead to toxic side effects. The other thing that can happen is that it's possible that when you combine the CBD with the medication, that the medication gets processed really, really, really quickly, so quickly that there's not enough of it left in the bloodstream to have an effect. And so that's one thing. The other thing is that, when you do combine certain medications with CBD, there is, again, like I mentioned, the potential to cause a liver injury, right? So that is something to watch out for.
Good point. Thank you for sharing that with us. And that also brings to mind dosing. Mm-hmm. That's a question we get so often. And as we know, administration when it comes to pharmaceuticals is very different when it comes to cannabinoid therapy. So could you share a little bit about that with us?
Yeah. So CBD is a very, cannabinoids in general, right, including CBD and THC, they're unique molecules in that they're fat soluble, right? And most other medications that you find on the market, prescription medications, even over-the-counter medications, are water soluble. The other similar supplements that I can think of that are that are fat soluble are vitamins A, D, E, and K. Okay. And so what happens is that these chemicals get stored in the fat cells in your body. And so you can overdo it, right? Because you could have maxed out the storage in your body, and then all of a sudden you're adding more and more and more. So it's almost like, think of the fat cells like a closet, and the closet can only fit so much. And if you try to pack in more and more and more, it's just going to overflow. And so that's important because, as we all know, we all process fat cells differently, right? Some of our bodies hold on to those fat cells really tightly. And it's really difficult to get rid of them. Whereas for others, they burn off the fat cells really, really quickly. And then, like I also mentioned, the machinery in our liver is different. It's different for everyone. So, there's variations in how we break down chemicals. So those two main factors impact things like dosing and frequency of dosing, okay? So, and as an example, let me give you an example here. So I had two patients, and I may have given this example before, I don't remember, but two patients who had insomnia. Otherwise, they were, completely healthy. They had similar body size and body shape, so similar BMIs, body mass indices. And I recommended the exact same high CBD product because they were struggling with mild to moderate insomnia, and high CBD is very effective for mild to moderate insomnia. And one patient needed 0.5 milligrams to sleep better, and the other patient needed 50 milligrams to sleep better. Okay, so you can see the difference there, and it had nothing to do with body size or body shape. So we're all built differently on the inside. So that's a factor that's important to take into consideration. And, in medical studies, I've seen pretty high doses, right? We're talking about up to, in the thousands of milligrams, depending on the condition, the severity of the condition. In patients that I've treated, again, depending on the severity of their condition, they've taken up to milligrams in the thousands as well. But then, like I just mentioned, I have had patients take less than a milligram of CBD, and it's effective for them. The other important thing to know here is that you're aiming for optimal, not maximal, when it comes to cannabinoids. There's a misconception out there that the more and more you take, it's going to be better for you, right? You're going to get a great effect. Not the case. Okay, so what ends up happening is that your body develops a tolerance when you overdo it. And when you develop a tolerance, you could take more and more and more, and your body's almost being numb to the benefits. And instead, what you're going to experience are side effects. Okay, so optimal, you're aiming for optimal dose, optimal frequency of dosing, as opposed to maximal. Okay, so that you don't develop a tolerance and you continue to gain benefits from the cannabinoids. So, so it's complicated, when it comes to dosing. There is no one size fits all. You do want to start with smaller doses, but in certain cases, I've had patients start with higher doses just based off their medical history, knowing that this patient in their particular case, they are going to need higher doses. So what varies from patient to patient is the baseline dose that I start them at, and in what increments I have them increase the cannabinoids at as well. And a lot of that is based on medical history, specifically the condition, the severity of the condition, the duration, the frequency, what medications they've tried, what results they've experienced from the medications. And, if they've already tried cannabinoids, what strengths have they tried? What doses have they tried? And what have their results been? And so those are all the different factors that are taken into consideration when I recommend cannabinoids.
Very good. Thank you for that. Do you have a hesitation at all when it comes to prescribing or discussing THC with parents who are interested in looking for benefits for, let's say, their children, for THC for children, to keep it simple?
Yeah, no, I don't have a hesitation. It just depends on the condition, whether or not the child will benefit from the THC. So what's important to know here is that there are certain conditions that benefit from high amounts of CBD. There are certain conditions that benefit from high amounts of THC. And then there are certain conditions that need both CBD and THC. Okay. And I don't have my book on me, but in my book, there's a chart where I list the specific conditions that benefit from high amounts of CBD, high amounts of THC, and from both CBD and THC. So no, I have no hesitation. I am very cautious in the dosing process, though, just because I know what the limits are, and how much buffer room I have until I get to that point. So yeah, I no hesitation. Depends on the medical history, and I'm very measured in my approach in terms of recommendations for dosing.
Very well. Let's talk about your particular practice. What is your typical client that you see?
Oh gosh, it's a wide range, all the way from children up until folks in their 90s and sometimes even beyond that. In terms of the most common conditions that I've treated, they include things like chronic pain, anxiety, insomnia. But then again, with the pediatric population, it varies more along the lines of autism, epilepsy, etc.
We've definitely seen a rise in our older population. Do you find that there's more of a stigma that you find with people that might be older when they come to you?
Yes, it's very generational, the perception when it comes to cannabinoids, right? Especially marijuana. So there is a lot of hesitation when you get to, I would say, even for 40s and above, just because of the ideas and the stigma and the taboo with which they grew up surrounding marijuana, actually. So typically, there are a lot of conversations that have been had with friends and family members before approaching me. And typically, what happens is that it's a child of the aging parent that convinces them to consider um, uh, you know uh, cannabis-based treatment options for whatever it is that they're struggling with.
There's a favorite quote of mine by Joel Stanley that says, once you learn what it is, the controversy goes away.
Yeah.
And so I love that because it does speak to the power of education. And really, when you learn about cannabis or cannabinoid therapy, you think, oh my God, what's the big deal? So what are some of the concerns that you get? People coming to you, we get that too. Usually it's my daughter, my nephew thought that this might be helpful. What are some of the concerns that most people have?
Yeah. So, patients don't want to get high off of the product. That's I think on top of most people's minds. And what they don't know is that all comes down to how you use the product, right? So first and foremost, what combination of cannabinoids are you using? If you're using a high CBD product, you're likely not going to get high off of it. If you're using a high THC product, it's only when you get to toxic doses do you start getting that euphoric effect. But if you're in that therapeutic range, you're not going to ever feel high. You'll feel the medical benefits, but you won't ever get to the point where you feel high. So that's a primary concern. The other one is method of administration. People are against smoking, understandably so, because the research does show that even when you smoke cannabis, there are long-term effects on the lungs, right? It contributes to inflammation, which can contribute then to recurrent infections, and even can contribute to lung function long-term as well. So that's another concern. And then for those who get tested at their workplace, drug testing is a concern. And this is becoming more and more of a concern as more and more states legalize for recreational use, because a lot of times the laws aren't addressing, well, what happens in the workplace, right? Marijuana is now legal for recreational use, but what happens then? And then, folks also get concerned when it's a hemp-based product that these products have less than 0.3% THC. If it's a full spectrum product, will I test positive? And so yeah, I would say these are some of the more common concerns that come up, and so I address them during my consultations.
Fantastic. And this is such a good point, and something that comes up so much for us as well is, can I test positive taking CBD? And even with a CBD isolate, I wonder if there couldn't just be real trace amounts of THC in there that could possibly accumulate in the system and cause someone to test positive in the great future.
Yeah. So yeah, let's talk about that. So when it comes to hemp-based products, we can put them into several different categories, right? So we have full spectrum CBD hemp-based products that have less than 0.3% THC, broad spectrum, which have less than 0.00% THC, and then you have isolate products, which technically should have no THC. So these are all theoretical. Okay. In reality, there's no guarantees that you'll never test positive, even if you take a hemp-based product. But we have to consider likelihoods, right? So with hemp-based products overall, there's less of a likelihood than if you're using a marijuana-based product. And then the likelihood decreases. There's more of a likelihood with full spectrum CBD products, and then compared to that, there's less of a likelihood with broad spectrum CBD products, and then even less of a likelihood with isolate CBD products. But bear in mind, the likelihood is still there. A lot of it, again, boils down to how your body holds onto these cannabinoids, right? And so let's just say you're taking a full spectrum hemp-based CBD product. There is less than 0.3% THC. And if you're taking this on a regular basis, there is a possibility that the THC continues to accumulate in your body, and it, when you get tested, it could surpass that minimum cutoff, and then you test positive. There's a lot of nuances that we don't know yet. So I would, there are companies out there making guarantees that you'll never test positive with their product because it's either broad spectrum or isolate CBD product. That's not the case. You could still test positive. It's just that the likelihoods are low.
Yeah. This is true. There's a lot to learn still.
Yeah.
Let's talk about cancer for a moment.
Yeah.
Unfortunately, cancer is something that we hear about daily. All different types of cancer. Let's talk about cannabinoid therapy in relation to cancer.
Sure. So I want to start with the research first, okay? There has been research that's been done in animal models, namely mice, as well as in test tubes and in petri dishes. And some of this research points in the direction that cannabinoids do have anti-cancer properties. Now, where we need to sort of exert a lot of caution is in making the claim that cannabinoids cure or treat cancer in humans, because we're not there yet in terms of the research, okay? And also, just speaking from a clinical perspective, I have had patients come in who happen to have cancer, but they're using cannabinoids for another reason, whether it's because they're experiencing nausea or vomiting from chemo, right, or loss of appetite from chemo. These patients have taken cannabinoids over an extended period of time, and I've seen no direct correlation, a consistent direct correlation from patient to patient to patient in terms of the continued use of cannabinoids steering the cancer in one direction or the other. Okay, some patients have improved, but it's not necessarily attributed to the cannabinoids. They're undergoing conventional treatment, whether it be chemo or radiation. And some patients have, their cancer has worsened. And again, not necessarily attributed to the cannabinoids. They are undergoing chemo and radiation as well. So that's my take on it. Is that, the research is pointing in a certain direction, but I would not go so far as to say that cannabinoids are treating or curing cancer. I've also seen cases where, unfortunate cases where patients, for whatever reason, misinformed from Dr. Google, they've taken information and have decided to forego conventional treatment options completely, where there is a tremendous amount of data behind the conventional treatment options to show that there is a lot of curative potential with the conventional treatment options. They've foregoed it completely and have decided to turn just to cannabinoids. And then a year later, their cancer has progressed because they put all their eggs in one basket. And I've encountered that one too many times as well. So first and foremost, be careful of the information on the internet. I think there's a ton of misinformation out there. Be well informed when you do make medical decisions. Go to the right sources for information, and then use that information to then make decisions about your body.
Something we often talk about when speaking of cancer and many other disorders or diseases is the use of both, of going the medical route as well as the alternative route.
Sure.
Also can be very helpful with side effects from chemotherapy and other traditional therapies. What can you tell us about that?
Yeah, and that's definitely an approach that I've taken with my patients. Like I mentioned before, the patients who are undergoing chemotherapy, for instance, who are struggling with nausea, vomiting, lack of appetite. Then there are those patients who have undergone chemo who then have residual nerve pain. In those patients, I'm helping them with cannabinoids to help manage their pain as well. So yeah, that's definitely an option that's available to those who have access to cannabinoids wherever it is that they're residing. But yeah, that's ultimately what I would say.
And one last topic is end of life.
Mm-hmm.
How do you see people with in a terminal case using cannabinoid therapy?
Yeah, so in that case, it's very useful in making the patient comfortable, right? Because at that point, that is what the main focus is how can we make the patient comfortable? And oftentimes what's utilized are opioids. And that can ultimately have an impact on mood. And also just quality of life because they're highly sedating as well, right? So the patient is spending most of their time sleeping, in this very lethargic state. So where cannabinoids are helpful is using cannabinoids in conjunction with opioids, right? So that way you can help lower the dose of some of the opioids that are being used. But in this particular case, the euphoric effect is wanted, right? Because it elevates mood. It induces more laughter. And so mood wise, and then also quality of life wise, because you're lowering the doses of the opioids, the patient isn't as lethargic. And so they're able to interact more with their loved ones, right, who may be visiting them. So that's what I would say. And actually, recently I gave a lecture to some fellows who are training in hospice and palliative medicine. And, so this was actually a question that they had asked me. So great question. I have medical professionals asking me the same question, that what role do cannabinoids play when it comes to palliative care? And this is ultimately the role that I see it playing is overall quality of life. And also, the impact on mood and the quality of interactions that they're having at that point.
Well, very well, thanks. So a more personal question. For me, I find it unique that you're a medical doctor that specializes in cannabis.
Mm-hmm.
And I wanted to ask you, how is that seen, or what has been your experience in relation to your medical peers?
Yeah, so for the longest time, this was my greatest fear in entering this field of medicine, is losing the respect of my colleagues. Because let's face it, this isn't, at the time that I entered into this field, 2012, this wasn't exactly the most coveted field of medicine. It's not like I was, pursuing cardiothoracic surgery, right? And so for the longest time, I never openly spoke to my peers about what I do. And it wasn't until around 2018 that I started to become more and more vocal amongst physician communities about what it is that I do. And what was a surprise to me was that they took an incredible interest in what I do, right? I was afraid, I was terrified, petrified of the fact that I would be looked down upon, I would be ridiculed, and instead there was an interest because what's been happening since 2012 is that there's been this snowball effect. Ever since Colorado legalized for recreational use, we now have more and more states legalizing for recreational use. We have more and more states legalizing for medical use. These products are available over the counter, and so they're being more and more utilized. And patients have questions, and they usually turn to physicians for answers. And a lot of times the physicians don't necessarily have answers. So now what I've been doing, like I mentioned, is I'm going around educating medical students, medical residents, fellows, and even fellow colleagues on just, the basics of cannabinoids so that they can answer their patients' questions in a well-informed way. And even know that, in what situations in their practice, can cannabinoids be of utility as a medication. So yeah, it's been quite a journey over the past couple of years in terms of coming out to my peers. And it's been a journey of overcoming a lot of fear. There was a lot of nervousness. I actually took it upon myself to reach out to medical societies and to reach out to conferences that are held for physicians and speak. I sort of had to just bite the bullet and was like, do this because one of my main goals is to impact as many lives as possible. And that's the way to do it is to go around educating. So now I have more and more physicians coming to me asking, I want to know more, teach me. So yeah, that's where I'm at in my journey. But it was definitely for a good 6 years, I didn't talk to other physicians. There was a lot of, I knew the value of the work that I was doing and the impact that it was having on patients' lives. But physicians, I think, as a whole, tend to be more conservative. And so, approaching them without fear was difficult, really, really difficult. So, but that's where I am in my journey. So basically, point being, don't let fear hold you back because you never know what's on the other side of fear.
I love that.
Yeah.
And that goes for so many things in life. But what is it that so a lot of our clients are afraid to talk to their doctors, and
just like me.
Just like you. However, we always suggest, please talk to your doctor about any type of alternative therapy that you're doing alongside or with. So what would you tell those clients that are afraid to come out with their doctor?
The fortunate thing is that we now have a growing population of physicians that are very open to alternative treatments. And they are actually, going out and seeking education about alternative treatments as well. So you have a choice as a patient of which, medical provider to select. So, first and foremost, I would, ask, before you even develop a relationship with this physician or provider, ask, listen, I want to incorporate cannabinoids into my treatment plan. Are you open to this? And if they're not open to it, then that may not be the right fit. Okay. So that's first and foremost. And I think it's important to have a foundation of trust with your physician, because we're dealing with the human body here, right? And a physician is a mechanic, and if you don't relay all the information that's needed, then we as mechanics of the body, we don't have all the information that we need to drive the treatment plan in the right direction. So that's the other thing, is that not only is your physician open to, some of these alternative treatment options, but, is there a foundation of trust with your physician? So I think that's important as well. And that trust then leads to open communication. So these are some of the things that, you want to be looking for. It's not a matter of, yes, you want, the best physician out there, but you also want a physician that you can trust, you can be open with, and that's open to some of the other treatment options that are available out there other than just conventional medications, right? So a lot of the, for instance, the autism patients that I've treated, it was their physicians, the parents were discussing CBD with their physicians. The physicians said that, hey, listen, I don't know much, but they somehow knew of me. And so they'd refer to me, and then I'd walk them through, okay, well, this is what I would suggest. This is how I would suggest using it in your particular case. And so, there's a collaborative effort going on there between myself and then the treating physician, the conventional treating physician.
I really like that you bring that up. I've noticed in my personal life, when I see you mentioned being a millennial doctor. When I do see younger doctors, I'm so happy to see that they've recommended supplements. They're recommended yoga for anxiety. It's not just traditional medicine. Is this something that you see mostly with millennials or younger doctors, or is this something that you see prevalent even with more mature medical professionals?
I would say if you look at numbers of physicians who are open to complementary and alternative medicine, as the generations go by, you'll see more and more physicians that are open to it, for sure. I think there's greater skepticism in those that were trained, generations before us, just because, there wasn't either clinical evidence or research-based evidence. But we have now, more, it's limited, but we still have some research-based evidence to go off of. And we're seeing the clinical results in patients as well, right? And so it varies from generation to generation and how you were taught. And in fact, nowadays, I know at my own medical school, they had a whole medical education seminar on complementary and alternative treatment options. So this is now, being incorporated in medical education as well.
Very good.
Yeah.
Well, I want to remind our viewers that Dr. Patel does have a YouTube channel. She does have a book out, and you also do virtual consultations from all over the nation.
All over the world.
All over the world.
Yeah.
Right.
Yeah.
And we will put more information in the links if you would like to reach out to her and have more questions. Dr. Patel, I'm so happy to have you here for the second time around, and something tells me we might see you again in the future. So thank you for all that you do and for clarifying and explaining more about how cannabinoid therapy and also the medical world intersect together, and for being with us again today.
Yeah, absolutely. And for the viewers out there who have questions, post them in the comment section below. And, for the next time around, I'll be more than happy. Whoops. Am I still with you?
You're with us.
Okay, perfect. I got a low battery.
Okay, well, right on time then.
Okay, so what I was saying was that for viewers out there who have questions that have come up, post them in the comment section below, and then we can go ahead and answer them the next time around.
Okay, well, thank you so much. It's been wonderful, and we'll see you again in the future.
All right, have yourself a wonderful day.
Okay, bye-bye.